I figured I'd go ahead and record this since most people don't understand what it's like to take heavy-duty medication when they've been in pain for as long as I have. So, preface this with last Thursday, well, just a few days ago, about 4 days ago, I saw a new pain specialist who asked a few questions, poked a whole bunch of painful places, and I brought him every pill bottle I could have potentially brought him. And I said, this prescription's from 2018. It had 31 pills in it when I moved to Georgia. It has like 27 in it now. And I said, I only take them when I absolutely have to. I really do not abuse my medication. I never have. I'm not an addictive person. I've never understood addiction, because for me, I think the only thing that could be considered addiction is my control issues. So having problems with my health has always been really hard, because most doctors just think you're crazy and they don't want to help you, and they just think that you're after drugs. So my pain specialist from Florida, Dr. Robert Mayello, was amazing. I loved that man. He was probably the most straight-shooting, straightforward doctors ever. He retired in December of 2016, and then I was left trying to find a replacement for a man I had been seeing for over a decade, who called me on my bullshit, who told me to sit down and shut up and listen when he speaks instead of trying to run over him, because I have a bad habit of doing that, because, ADHD, and something pops in my brain and I just instantly start blurting shit out. And I can't like regulate that sometimes. I can't just like stop and take a step back. So he's like, stop. He was really an amazing doctor. And I know my friend Denise, if she actually watches this, didn't like him. She had the opposite reaction to him. So it was funny that somebody that I know personally, that I'm friends with, has actually also been to this doctor, and she had a completely different experience with him. But I need somebody that will be firm and that will be like, shut the fuck up. So I went to a couple of pain specialists. I tried getting in with another one when I was in Florida, and I just either couldn't get anybody to call me back, they were filled, or whatever. So I ended up going to one doctor, and I stopped going to him in February 2018 because he terrified me one day when he followed me to my car after making me wait for over 4 hours in his waiting room to be seen. Then his office staff was rather unprofessional and rude, and I sat in the chair in the room while his nursing assistants, all three of them, piled on the thing that the patient sits on and starts coloring on the paper with pens, while he is nonchalantly leaning against the counter to talk at me. When I was leaving and I was checking out, I made a comment to the woman and said, it's very unprofessional how those girls were just in the room doodling on the paper the entire time. I said, I've been here since 4 o'clock. I had a 4 o'clock appointment. I came 5 minutes early for my appointment, and it's 7:30 now. 7:30 was when he finally saw me. It was 8:15 when I finally got out to my car. He followed me out after speaking with the lady checking me out, and said he didn't like how I spoke about his medical assistants. I said, had they been professional, I wouldn't have said anything. But they've never been professional, and they've always been like this. I said, and I don't like it. And he followed me all the way to my car and absolutely scared the shit out of me. I reached in my bag and got my hand on my weapon because I was going to protect myself against a 6'4" doctor who was terrifying me at my car. And I never went back to that office. That was the last time I had gotten a prescription from him, which was filled in March of 2018. So when I went to this new doctor, explained everything, and came out of there with a pill bottle, or well, with a prescription for, I'm trying to get one out, for this little blue pill right here. And he didn't have a problem giving it to me after I explained what I had taken over the years, what worked and what didn't work, what medications I would absolutely never take again, and how some medications I have found react negatively with me, and that I literally refuse to take them. Like, I will take myself off a medication if I feel it is harming me, like the Savella that I was taking recently. So when I literally brought him, I have, now this has pendants in it, but I have all these like little Publix bags that I had like 2 levels of medication. If you saw my picture from the other day, it had like 3 pill bottles across the bottom, 3 pill bottles across the top. I had 3 baggies that I brought him, and 2 loose prescriptions because I grabbed them on the way out of the bathroom, which was my migraine meds. He had no problem, after I've been to 4 different pain specialists here in Georgia, no problem writing me this prescription for morphine. Because he took the time to talk to me and listen and ask questions. I brought him lab works. All the labs that I've had done for the past 6 months, I brought him those. I brought him my genetic testing for Ehlers-Danlos because he's like, well, why don't we get you tested for Ehlers-Danlos? And I said, unfortunately, I just did. The paper's right in front of you. Look for Invitae. And he looked for it. He goes, oh, crap. I was like, yeah. So instead of having one condition that wraps all of my multitude of conditions into like one disease that makes it easier to explain to a doctor, oh yeah, by the way, I have Ehlers-Danlos. Instead, I still have to say, I have fibromyalgia, I have connective tissue disorder, I have POTS, I have lax tendons, I have chronic fatigue, I have primary severe restless leg, I have, this, and then you kind of scroll through your list of everything that you have. He's like, yeah, that probably would have been a nice even diagnosis. I said, well, I'm fighting with disability right now. I've been trying to get disability since I was 20. I've had these health problems most of my life. It would have been nice to have that label to just give the information to disability. But the thing is, even with Ehlers-Danlos, it's still hard to get disability because they still see fibromyalgia as being all in your head. So bringing it back to the medication, after he spent an hour with me for my first appointment, he had no problem writing me one for muscle relaxers and my morphine. He's like, what did you find that works? I says, well, he goes, what muscle relaxers have you taken? And then I listed off some of them, and I said, well, this one makes me this, and this one makes me that, and that one there made me feel like I had bugs crawling on me. The methocarbamol, that stuff is awful. Never take that shit again. An allergic reaction to it because it's got shellfish in it. Also, be careful with your meds if you are allergic to iodine like I am. Make sure that there's no iodine in your medication. So he's like, okay, so what do you have with you that you can take that does work? I says, well, I have them, but there's a caveat. He's like, what's going on? I said, well, the tizanidine, because, Flexerol doesn't work for me. I can take an entire handful of that shit and not have it work. Xanaflex, aka tizanidine, is a nice muscle relaxer. It's a nice, mild muscle relaxer at 4 milligrams. Most people can't handle it at 4 milligrams, so they do have those like lines on there where you can break them into quarters, which it is a nice, even muscle relaxer. If you don't have blood pressure issues, I've always had low blood pressure that likes to bottom out. I was always 90/60 when it came to my blood pressure. So tizanidine actually causes my blood pressure to lower, and it is a common side effect of the muscle relaxer. And I do have pills left over from the last time I had that filled. And I do take them, but I can only take them when I know I'm going to be home and 2, able to go to bed. Because I can't function on them and be safe. Because even taking a half or quarter of them, I actually passed out at the flea market one day on a quarter of a tizanidine and had what looked like a full-blown seizure to the people around me that saw me collapse. And what it was is that my blood pressure dropped and my body seized because my blood pressure dropped. So even though it's an effective medication for releasing the tension in the muscles that I have issues with, it's not a safe option. So the other one that I have is this one right here. This is baclofen. This is a 10 milligram tab. These are actually smaller than the ones that I had. I had 1.5 pills left of those. And he's like, how come you still have pills? I was like, because I'm afraid I'm going to run out. He's like, that's not good. So he was able to write me this. I have not taken one of those. I took the half of one earlier today because Jason had to go get these for me. But I live day to day in pain. And I wake up in pain. I go to bed in pain. Breathing is painful most days for me because of my back. And at 10 after 10, which was, 45 minutes ago, I took one of my new morphine pills. Now, I haven't had morphine in like 3 weeks because the last time I took it was when I was in that Amavig migraine injection freak out that my body had. I took one while I was in that because I couldn't function. I went ahead and ate cereal, so I have stuff in my system. And yes, I'm one of the weirdos that puts milk in a bowl and then pours the cereal in a little at a time and just eats it until I run out of cereal, and then I add a little bit more because ain't nobody got time for soggy cereal. And it melts the frosting on the top of the mini wheats, so it makes them less fun. So I always just bring a bowl in with milk and then add the cereal, which is why the box is sitting on my desk. So I noticed, I was going to set a timer, but I was like, whatever. I'm sitting here watching Netflix. I took the pill at 10:10, and they're every 12 hours, which is fine because he asked what I was prescribed. I said 3. I was supposed to be 3 times a day, and I said I only took them like every 8 to 12 hours because I only took them as needed. He's like, that's fine. We'll start you off at 12 hours. Sounds good. Extended release tablets allows them to release slower in your system anyway, so that they last longer. Now, with that being said, taking one at 10:10 and then eating, because there was nothing really in my stomach, allowed the medication to work a little bit faster than normal because of the fact that I've been sleeping basically since 5 o'clock today because I felt like absolutely dog shit today. The pill kicked in, I'd say about 22 minutes after the hour, so it took about 12 minutes for the medication to kick in. Now that I've been sitting here, I've been recording this for 13 minutes, things still hurt. I'm not gonna lie, things still hurt. My legs are still burning, my back still hurts. But, and I actually I'm on my heating pad. Which it turned its ass off again. If you ever have a heating pad that just randomly turns itself off and it hasn't been the 2 hours, unplug it from the wall because you need to decharge it, because the Sunbeam, whatever it is wrong with Sunbeam, they seem to like collect a charge in the controller, and it causes issues with the controller. So you have to unplug it for a few minutes and then plug it back in to decharge it. Most asinine thing ever, having to fight with your heating pad, because it's only been on since 10 o'clock, so it hasn't even been on an hour. So right now I can finally go, and my ribs hurt, my shoulders here hurt, but I can go, and my entire back doesn't light up with pain. Do I feel different? Yes. For the first time today, my mind actually feels clear. Like I can actually think clearly without a bunch of fog in the way. My neck still hurts, but I woke up this morning with a horrible migraine pain. Horrible. Like the whole back of my neck, the whole back of my head, this entire side of my face. I was tore up this morning when I first got up at like 9:30 because of the fact that my entire head was really just throbbing bad. And when I'm in pain, it affects my voice. So people think, oh, are you okay? You know, you sound really bad. Well, yeah, it's because I'm in pain. The more pain I'm in, the more raspy my voice gets, the more hoarse I sound. And the less I can function. Since taking this medication 50 minutes ago, my brain seems more clear. Granted, I still have pain. That's to be a given. This is not a miracle drug. But my everything doesn't hurt as bad, which is really nice. Now, for some, morphine doesn't work. For me, it always has. I've been taking it off and on since the early 2000s. There are other opioids that you can take, like anything in the codeine or codeine or codone family, but technically I'm allergic to it. Anytime you take a medication and it makes you itch, that's a bad thing. You don't want to take a medication that makes you itch because it's a sign of an allergic reaction. With the morphine, if you do have pain that is chronic and you find a medication that just kind of allows you to breathe and not be in excruciating pain, to me, that's a bonus. I can take a handful of medication and not literally be affected by any of it. I don't know if it's because my grandmother was French and Irish. I don't know if it's because red hair runs in the family. I don't know if it's because I've lived with chronic pain for literally my entire life, that my pain tolerance is so much different than everybody else's. Like when I had my C-sections, I had to get 2 spinal injections. 2. You know, the one where they numb you from like here down? Yeah, I had to get 2 of those because I was medication resistant. I've always been medication resistant, which is probably a good thing that I'm not an addict because I can only imagine what it would be like to have somebody that's addicted to something that is medication resistant, and then they have to take twice as much just to achieve whatever the high is that they're trying to get. I don't like being high. I don't like being out of control. I am a control freak. I have ADHD, I have bipolar type 2, I have a lot of other issues, and I do not like being out of control at all, period. I don't like it. I like understanding my body. I like knowing what I can and cannot do with it. And there are days that I literally can't do shit with my body. But because of my mental deficiencies that have made me, as some people call it, neurospicy or neurodivergent, it has allowed me to be more in tune with my own body and everything around me and even people, that it has allowed me this lovely observational skill that most people don't come built with, and makes me more sensitive to things than some people may react to certain things. So long story short, I'm glad that I can just fucking breathe. And I haven't taken any other meds. My night meds are still here. I haven't taken any of those yet. I'm on very minimal medication right now because I've taken myself off of so much of it. So as of right now, I'm on the Trulance, which is the IBS-C medication. I'm on pantoprazole, which is for the fact that I have a hiatal hernia and I have esophageal narrowing. So basically the inside of my throat looks like one of these guys, which this is a lifesaver. So the base of my throat is basically narrow to the point where one of these won't even fit. This is a mechanical pencil in case you're curious. And yes, I'm so old school, I still write with pencils. On, you know, this stuff. This stuff, it's called paper. By the way, this is wide rule. I hate wide rule paper. I prefer college rule. But for the first time in weeks, I actually feel relaxed. My body has this like nice little like tingly like whoosh thing going on, and relax is not a word in my vocabulary at all. When I went and had my my IV done the other day, she's like, no, just sit here and relax. I'll dim the lights. I'm like, I told her, I said, I'm sorry, but could you please define that word? I don't believe I understand that one. And she laughed at me. I said, because that's not in my vocabulary. And she thought I was joking. But I've always been because of my pain, I've always been very rigid. My body's always rigid. My muscles are always like this. I mean, you can still see the muscle on my neck, and it hurts right now. It does, it hurts. It's pissed off. But this one here is less pissed off. You can actually see the notable difference from one side of my neck. See how raised this is compared to this one? This one is more relaxed right now. This one's still all pissed off and angry. But isn't that crazy that literally just sitting here, you can see the difference in one side versus the other. So the pill hasn't gotten to this side yet. But the other side it's working nicely on. And I'm just grateful for the doctors that I do have right now that are willing to work with me, sit and listen, talk, ask the right questions, and tell me to shut the fuck up when I need to be. Because ADHD is not always for the win. It really isn't. So this coming week I have a cardiology appointment. It's probably time for me to get another stress test anyways, because it's been since my heart attack, since the last one I really had. So I really need another one of those. Might as well check in and make sure my heart is going thump squish like it's supposed to, because I have an MVP. If you don't know what that is, it's a mitral valve prolapse. I have a leaky valve with regurg, and I have a heart murmur. And of course I had a heart attack at 27. So I'm going to let the doctor do their job and leave minimal details in there and say, yeah, I've had some heart problems over the years, but I'm going to let you use your degree to deduce things, and I will let you do your testing, and I'm not going to feed you any information. I'm going to let you do your job. And some doctors don't like that. So we'll see how it goes, but I'm going to a place called Emory, which here in Georgia, they're very prestigious. They're very well known. They're very good. They have a wide variety of specialties that work out of the one umbrella. And actually, one of my supervisors for Nike actually goes to Emory with her daughter, who also has migraines and stuff. So she's like, oh yeah, they're really great. See if you can get in with some of their other doctors and stuff. She's like, they're really fabulous. So so I'm glad. I'm gonna go to do that this week, and I have had an appointment with a psych doctor in the morning for disability. One morning this week. The paperwork is up there. But so that's what's going on with me right now. Medication, one of the medications is on board. I have not taken the muscle relaxer yet. I'm supposed to take those every 8 hours. I will probably wait to take that until I need to go to bed. Just because I'd rather have it relax me enough so that I can go to bed and just kind of before I go to sleep, and not be curled up in a ball in pain. So just wanted to give a update on that, because I know I got a phone call from Miranda earlier today, because she saw my other video and was worried about me, which there's only a couple people that commented on that video, but she's the only person that's actually called. So it is one of those things. So I'm going to let you guys go. Thank you for watching. I just wanted to give an update. So the new meds, one of them's on board. So I'll start seeing how this goes. I know I'm supposed to take them every 12 hours. You're not supposed to not take them, which I have a bad habit of doing, because either I forget or I'm like, no, I don't need them right now because I'm not in pain. But then it starts to wear off and I don't take it, thinking that I can push through again in the pain. And the doctors are trying to get me to stop doing that. I don't know what's wrong with me mentally, but I swear, they're like, no, we don't want you in pain. We need you to take your medication like you're supposed to. I'm like, but. They're like, no buts. Just take your damn meds. That's why you have them. I have a really hard time of just taking my medication. I'm like, but I don't need it right now. I'm fine. I can power through this. So you need to stop doing that. That's putting stress on your body. And it's doctors that do that for me that make having a chronic illness actually work a little better, because sometimes I need somebody to argue with me. I'm a Libra, Scorpio. So I like the balance of stuff, but there are times when I'm sitting there weighing the pros and cons of stuff and I get distracted. I'm like, oh, look, something shiny, and I wander off and I completely lose where I was, where I'm trying to decide, do I need these meds? How much longer can I go without taking them? Okay, they're starting to wear off, but they're not worn off yet. How long has it been? Oh, it's been 12 hours. Oh, I can go another 13 hours. Or let me wait another hour and see if I can still go without taking the pill. Or, oh, let's see if I can push this to 15 hours. I really need to stop doing that. Because as somebody that lives with a chronic illness, I'm not used to having medication help me with things. And when I do have medication help me with things, I like try and like let it last and stretch it out as long as I can so that I can get it to actually work longer. But it's not gonna do. It's got its own limitations. It may be extended release, but it's only gonna work for so many hours and then it's gonna stop. It's not like it's a 24-hour miracle drug. Morphine is also fallible like people. So do as I say, not as I do. Number one recommendation, don't try and fight your body when you have meds. Take them. If they are beneficial to you, take your meds. Don't argue with your own body and go, but maybe I can wait. Maybe I don't need it right now. And then that's how I end up with extra meds because I don't take them as often as I'm supposed to. So I'm going to try and get better about that. I really need to get one of those apps that reminds me like to life, as well as the ability to like write stuff down, like when I'm feeling bad and when certain things hurt versus other things and whatnot. Again, I'm really bad about doing that. So, well, I've been rambling. 26 minutes in. This side's still really sore. It hurts pretty bad. And my arm, for whatever reason, this arm has been really painful today. The dog pawed at me and hit it. Oh my God, it was like she just kicked a bruise. And I don't have any bruises up there, so I don't know why it's being all hateful. And before anybody goes, maybe it's a heart attack. No, last time I had a heart attack, it was this arm. Because I actually had a heart attack like a man. I didn't have a heart attack like a woman. Because women don't usually have the arm pain. Just FYI, when women have a heart attack, they have different symptoms than men. So like the common adage for a heart attack, oh, well, if you get like left arm pain and chest tightening and shortness of breath and sometimes what feels like heartburn, that's a normal like symptom for a male version of a heart attack. And I don't care if you're trans or not, if you are genetically a man, those are like the common things to having a heart attack. But for a woman, we can have a heart attack and not even know it. When I had mine, I felt lightheaded, I was dizzy, I had shortness of breath, I had blurred vision. But I had the arm pain. Mine was very pronounced. It was basically from here over, from front to back. So basically from my shoulder blade over the entire, this side of my chest cavity was like, and my arm was really sore. My neck and shoulder region were really like just touching like this was excruciatingly painful. It did restrict my breathing, but again, I had kind of like symptoms between a man and a woman. And genetically, I'm a woman. I was born a woman. I've always been a woman. I'm not trans. Even if you are trans, you will genetically always be whatever you were born. And somebody can argue with me until they're blue in the face, but I'm going to be very blunt about this. I do support trans. My mom of choice is trans, but she was born a man. And when she had her stroke, she stroked like a man. And when she called me to ask for help about stuff, I told her, I said, Mom, you didn't stroke like a woman because you're genetically still a man. Your DNA says you are male. Your chromosomes are male. You've been a woman for over 20 years, yes. But down to your base material, you are still a man, and you will always be a man until the end of your days. I may see you as a woman. You may present as a woman. You may take my watch thinks I stood up. It says I have achieved my stand goal for the day. I'd love to know how that is because I spent about half of the day in bed. But that's one thing that a lot of people like to get on their soapbox about when it comes to trans is your health problems are always going to go back to whatever your genetic basics are. So you can argue with me till you're blue in the face, but if you're genetically a man or genetically a woman or have chromosomes that match a specific gender. I don't care how you present, your health is going to always present as those first. I don't know why I've always been a weird exception. I have alien blood, I have missing pieces, I have extra parts, I have things that were supposed to be fused that were not fused. My mom has 3 kidneys. So I just figured I'm just a freak of nature. Doctors usually look at me puzzled because I have so many strange things wrong with me. And then like you go and you get tested and the doctors are like, oh my God, you weren't kidding. And you're like, I wouldn't make this shit up. So, yeah. So hopefully some of this information is helpful. If you have meds and you need your meds and you're in pain, take your meds. Don't be like me. Take your meds. They were prescribed to you for a reason. Hopefully your doctor gave a shit enough about you to prescribe something that is actually beneficial for you. Because also living in pain can cause so many other conditions between anxiety, stress. It can heighten depression. It can cause mental instability, because when our body isn't well, it affects other things with us. It affects our minds. It puts us into a depressive mind status. And as somebody with bipolar type 2, it's really hard for me every day to get up and stay here instead of here or here. So trying to stay here without medication. I have not been on medication for over 10 years for my bipolar. I'm doing everything myself. All of my self-control, all of my, okay, I need a moment. I'm mad. I let people know around me I'm mad. I need a moment to have a woosah. I need to step back and take control of myself and get my mind right before I can pursue whatever I was going after. And I need that time because I am controlling me. Is that probably the safest thing? Probably not. Some psychologists or psychiatrists are probably going to be out there going, oh, you need meds for your bipolar. I've been controlling my bipolar for a decade now without meds. Did I like having the assistance of my ADHD meds or some of the other meds that I was on? Yeah, I did. It was easy. I didn't have to think about it. I was just even keeled all the time. But those medications can kill your liver. And I'd rather have my liver be okay for the rest of my life than taking meds that help me be normal when I can just make myself normal, or as normal as possible. I'm not normal. I'll never be fucking normal. Don't ever. Brain. My thought just ran off my ear. So I guess I'm gonna leave this here. This is a rambly health update. Don't know where I'm gonna post this yet. I still have the other one on my phone that I need to throw up on YouTube. I did post them on social, so they're on like Instagram and Facebook and stuff like that, but not on YouTube yet. I have been working through editing my extensive backlog of videos that I have to edit lately. Start training in the morning, back with Intuit. I'm excited to go back to Intuit because their program is pretty straightforward. It's pretty easy, and I like helping the people that call in, especially the elderly people that call in, because a lot of them are just out of their depth. And at some points I feel the same way. So, but I like being able to help people. So if this helps somebody, I'm glad. Then maybe this ramble has been beneficial to somebody. So I'm going to go ahead and end this here. Thank you for coming. If you have questions about medications, or like if you want to know what meds I've been on over the years, when I filled out my paperwork for my neurologist, there was over 150 medications that I had to mark off on there that I have taken over the years. And then I had to explain to him why I don't take them, what worked, what didn't work, what reactions I had. So yes, I've had an extensive medical history. I have an extensive history with medications, what works, what doesn't work, what kind of worked, what worked for a short time. And I remember pretty much every medication I've ever been on for the most part, and what my reactions were to it. So that's also beneficial to most doctors. Most people can't do that. So anyways, questions, leave them down below. Feel free to comment. If you have a medical issue that's going on and you can't seem to get help for it, reach out. I'll see what I can do to like either help with whatever information I have or try and point you in the right direction on where you can go to look for information or how you can get assistance. I do not believe in like taking like drugs though that are not prescribed by my doctor. That's always been a sticking point for me. Because at one point my doctor did suggest putting me on like marijuana and stuff. The only time I've ever done marijuana was when I went through chemo, and I had a horrible reaction to it back then, and I really don't want anything else to do with it. Plus the stuff stinks. I mean, it stinks. And the neighbor behind us is constantly smoking some cheap trash smelling stuff, and that makes the whole yard stink. It makes me have a headache, and I don't know what kind of pot they're growing now versus the pot we had 25 years ago, but the stuff now stinks really bad. I don't want nothing to do with it. I don't care if it's a weed or not. Drug, weed, plant. I don't want nothing to do with it. Even though morphine comes from a flower. Go figure. Anyways, I'll see you guys later. Bye.